all they form the coverings of the testis. So these two, they belong to scrotum. Okay, whereas the inner layers, they belong to testis, which are also
Scrotum.
part of the spermatic cord. I will explain that. Okay, and even belong to scrotum. Did you understand this point?
Yes.
Okay. Yeah. So when you observe the skin of the scrotum, is it the same as the surrounding or different?
Different.
We have many. What are these? The folds of the ridges. You know, because why there is folds or ridges, and even during the change in the weather, in winters, the testis will go up. Okay, your scrotum is very small, whereas in summers the scrotum will sag down. You know, the testes are below. Okay, whereas in winter they go up. So this is because of the muscle which is present in the superficial fascia of the skin. So you have next to the skin a muscle which is present, that is called as the dartus muscle. What is it called as? Dartus muscle. D-A-R-T-O-U-S. Dartus muscle, which is responsible for maintaining the temperatures of the testis within the scrotum. Very important. Okay? Dartus. D-A-R-T-O-U-S. Okay? Because of that, even you have the skin, what is that? Creases. As just below the skin there is a muscle. Because of that, there are creases. Okay, which will allow the enlargement and then what is that? Pulling up of the scrotum.
Yes.
To maintain the temperature, optimum temperature for the testis. Dartus. Yeah.
This is the name of the fascia.
Of the muscle.
The muscle.
Yeah. So the fat is replaced by, there is no fat in the scrotum. There is no fat in the scrotal skin. Superficial fat, just like your eyelids, there is no fat.
Yes.
Okay? The scrotal skin below that, it also doesn't have any superficial fat. It is replaced by the dartus muscle. Am I clear?
Yes.
Okay. So this is innervated by, as I said, this process of testis going up, coming down, it's not under your will, right? It is purely autonomic process. So that's why that muscle is supplied by the sympathetic nerves, the autonomic nerves. Clear? So because of this, there is wrinkling of the skin. So now, next to that, you have the spermatic fascia. So as I said, it's an outpouching of the anterior abdominal wall. As the testes, they come or descend from within the abdominal cavity, go to the scrotum. So all the layers which are forming the anterior abdominal wall, they will be carried down to the scrotum. Am I clear?
Yes.
So what are the muscles in the anterior abdominal wall?
Anterior.
Anterior abdominal wall is done. So okay, sorry, it will be next year or in musculoskeletal. I think it is done.
No.
First year, man. Anterior abdominal.
Just the limb, Victor. Limbs and neck. Head.
I think in our GIT it will be done. I guess.
Yes.
Back,
Next 3 years, inshallah.
Yeah.
abdominal and back, not much.
Okay. So you have three muscles here in the anterior abdominal wall: external oblique, internal oblique, and transversalis fascia. What is the transversalis muscle? Okay. The same they come down. Okay. Following external spermatic fascia, then cremastic fascia, internal spermatic fascia. External spermatic fascia is nothing but continuation of your anterior. That is the external oblique. Okay. Then cremastic. So here there is one more muscle within the what is that? The spermatic cord or inner side of your the what is the scrotum. So scrotum, skin, superficial, you have the dartus muscle. You have the picture or not? Yes. So can you see this muscle which is covering? This is what is the spermatic cord. Spermatic cord. What is the spermatic cord meaning? It is the group of structures which are connecting the testis with the inside of the abdomen. Okay, group of structures which are going and coming from the testis to the abdomen through the inguinal canal. You know, you have inguinal canal in the anterior abdominal wall, superficial ring, and then deep ring. So the structures which are connecting the testis. Okay, group of structures. What are the group structures? I will explain it. Okay, so this cord is again covered by a muscle, which again pulls up the testis. Okay, along with the scrotum. So that is the muscle what we call it as cremasteric muscle, which is you can say continuation of the internal oblique muscle of the anterior abdominal wall. Clear?
Okay, clear.
Yeah. So what are the layers that you find? What a better picture, sorry. Okay. So you have external spermatic fascia and then cremasteric fascia, again the
Internal.
muscles covered by the same fascia, and then internal spermatic fascia, that is the continuation of transversalis muscle, inner side. You have three like this, 1, 2, 3. Outside, external. Middle, cremasteric. Inner side, internal spermatic fascia, which is continuation to transverse abdomen. Clear?
Yes.
So this cover the scrotum.
Inner side, not cover. That means you can say as the layers of the scrotum. See, this is the testis. This is the testis, okay? This is scrotum. So testis is covered by all these three layers. So that means even they form the layers of the scrotum. They are common to both scrotum and testis. Okay, as it is present within this.
Yes.
Am I clear? Okay.
Where is the first class?
Eh?
First class.
It is the part of the abdomen.
Yes.
Three muscles are there in the abdomen. First muscle is the external oblique. Then inner side you have the internal oblique, and then again inner side you have the transverse abdominis. Three muscles which make up this anterior abdominal wall. As I said, the scrotum is the outpouching of the anterior abdominal wall. So the three same, they are continuous. They are replaced. The muscles are replaced by the fascias. Only with the internal oblique, which is replaced by a small sheet of muscle, that is called as the cremasteric muscle.
Yes.
Cremasteric muscle. Did you follow?
Yes.
Okay. So and you have deep to this all, you have the inner side what? The peritoneum. Are you following?
Yes,
You have
yes.
the peritoneum. The same again, peritoneum continues down. Okay. So that is called as tunica vaginalis. What is it called as? The tunica vaginalis. Clear?
Yes.
Yes. Or you can say the process vaginalis. So they all form these all layers form the coverings of the testis, as well as the layers of the scrotum, as well as the spermatic cord. So as they all come from the abdominal wall, covering these structures which are going and coming from the testis. Okay? Yeah. So now coming to the spermatic cord. So what is the spermatic cord? The spermatic cord is a collection of structures that pass through the inguinal canal to and from the testis.
So abdominal.
Okay? Which are connecting the testis, like the testicular artery, which is a branch from abdominal aorta. It has to reach the testis. Testicular veins, draining blood from the testis, going to inferior vena cava. So it has to again come from. Testicular nerve, vas deferens. It has to come from the testis and then drain into,
Abdominal.
that is the urethra.
Mm.
Okay? So that's why all those structures which are going and coming from testis make up the cord-like structure. So when you go back home, you try to feel your own spermatic cord. So at the root of the scrotum, upper part of the scrotum, you roll your fingers. You will feel a cord-like structure. Your own scrotum you feel. Okay, you feel cord-like structure. That is the spermatic cord. That is the spermatic cord, which is nothing but all these components, contents. Am I clear? Okay. So that is what is called the spermatic cord. What is spermatic cord? It is a collection of structures which pass through the inguinal canal to and from the testis. Did you follow?
Yes, yes.
So then it is covered by the same layers as I explained. The internal spermatic fascia, cremasteric fascia,
And the external
spermatic fascia, and then the skin.
Yes.
Clear?
Yes.
So that is the coverings of the spermatic cord. It is the same for testis, it is the same for scrotum. Okay? And then structures within the spermatic cord. As I explained, the same. Vas deferens. Okay? And then you have testicular artery, the testicular vein. Here the veins is not a single vein. It's not a single vein. It is forming plexus which will be around this vas deferens. Why is that again? Because the part of the spermatic cord is exposed to the outside. The vas deferens is carrying sperms. Vas deferens is carrying sperms from the testis. Clear? So it has to be maintained. The optimum temperature has to be maintained. That's why all these form plexus keeping the temperature to the body temperature.
Where is it?
These are the pampiniform plexus of veins.
No, the bus difference.
Vas deferens will be inside. It's not shown here. You can see this here. Vas deferens will come there.
Not out there.
It's a tube. I will come to that. Wait. So it's a muscular tube, just like urethra or the ureter. You know the ureter? The vas deferens is also like a ureter, a muscular tube. Okay, carrying sperms from the spermatic cord and dropping them to the urethra, through which can pass out. Okay, I will come to that. Okay, so these all forms the contents of the spermatic cord. What are they? Vas deferens, testicular artery, testicular vein, testicular nerve, as I said, then testicular lymph vessels which carry the lymph from the testis, and even, as I said, the peritoneum also drags down. So some remnants of the peritoneum. So later what happens? The peritoneum, as the testis descends down, there will be, so there should not be continuation of the peritoneum covering the testis from the abdomen to the testis. So part only it remains over the testis, whereas in the spermatic cord it should disappear. Otherwise what happens? If there still the peritoneum is there, the contents of the abdomen may pass through that peritoneal opening and then form the hernia. To avoid that, there is discontinuity. Discontinuity. Okay. Some parts here and there they may be remaining. That is called the remnants of your process vaginalis. That means what is process vaginalis? It is nothing but the peritoneum.
Please again last word.
I said the testis, they descend from the anterior abdominal wall through the inguinal canal to the scrotum. Right? So as they are descending, they will carry all the layers of the anterior abdominal wall, as I explained. External spermatic fascia, internal spermatic fascia, and then the cremasteric fascia, right? So even innermost anterior to abdominal wall, inner side, what is there? Peritoneum. So as the testis, see here, testis, this is the anterior abdominal wall. You have skin, all these three layers, and inner side you have the peritoneum. So what is that testis? It is within the abdomen. It pushes out of the anterior abdominal wall like this, comes out of the inguinal canal. So when it is coming, it even carries all these layers. Okay, even carries the peritoneum. As it soon reaches the scrotum, the peritoneum from here, inguinal canal to the scrotum, covering the spermatic cord, all these structures, it disappears. It remains only around the scrotum. What is that? Around the testis. It will not be there throughout the length of the cord. Did you understand? Okay? So, the same thing as I explained, the same external spermatic fascia, cremasteric motherline fascia, internal spermatic cell, covering spermatic cord. So now coming to the testis. What is the testis? So as I said, these are the male genital, very important, what's the gonads we say. Gonads, okay, where the sperms are produced. Where the sperms are produced, just like the ovaries in case of females, where the ovaries are produced, okay. So, as I said, it is first develops in the abdomen before birth, and even it descends before birth into the scrotum, okay, through the inguinal canal. So when you observe the testis, both right and left testis, the left testis is slightly down compared to the right. Observe yourself again one more time. Okay. So left testis is slightly down compared to the right. Why? Because I will explain that later. Because the left testicular vein drains into the renal vein, which is down compared to inferior vena cava. That's why it is slightly down compared to right, which drains into inferior vena cava. The left testicular vein drains into left renal vein, like the ovary.
Yes.
Okay, as the renal vein is slightly at the lower aspect compared to the venous drainage of the right. Look to my hands.
Yes,
Okay,
yes,
this
yes.
is the left renal vein, this is the inferior vena cava. Right testicular vein
Vena
here,
cava is the-
left here.
Yes.
Slightly down. So that's why left testis is slightly down compared to
Yes.
the right testis. Clear?
Yes.
Yeah. So as I explained, the coverings of the testis, it is the same.
With the scrotum except
Okay,
the skin.
from outside you can come. Okay, we have the
External.
external spermatic fascia, internal spermatic, that is the cremasteric fascia, and then
Internal.
internal spermatic fascia, and then tunica vaginalis.
Vaginalis.
Tunica
Vaginalis.
vaginalis. Very important here. So this is what is the tunica vaginalis. Can you say? It forms two layers. It forms
Two layers.
two layers. Just like any coverings over the heart or the lungs, the viscera will have the parietal layer and then the visceral layer. So between the two layers of the tunica vaginalis is the cavity. Is the cavity. Am I clear? Is the cavity. So the patients with, you might have seen many patients with hydrocele. What is the hydrocele? Condition, what is hydrocele? Hydrocele is a condition where there is collection of fluid, the water, within the tunica vaginalis. Some people's scrotum is will look very big. The scrotum, like the coconuts, very big coconuts. Okay, so just the cause of which we don't know. Maybe many of the patients will give history of trauma to the testis, but actually we don't know the exact cause. Especially the old peoples will have this enlargement of the scrotum because of the collection of the fluid. Just like pleural effusion, pericardial effusion. Okay, the fluid collects within this tunica vaginalis, forming a condition what we call it as hydrocele. So hydrocele is a condition where there is collection of fluid where
inside the tunica.
not in the scrotum, it
The
is in the
tunica.
tunica vaginalis.
Okay.
Clear?
Okay.
Yeah. So that is about the coverings of the testis. And inner to the tunica vaginalis, you have a fibrous layer that is called as tunica albuginea. What is it called as?
Tunica albuginea.
albuginea. Which sends, this is what is tunica albuginea. Okay, the blue one. Are you following? You will
Yes.
learn it again in your histology. From this tunica albuginea, there will be septas. Okay, septas extending into the core of your, you can say, the parenchyma of the testis. Extending into the parenchyma of the testis, dividing the testis into lobules. 1, 2, 3, 4, like that. Okay, lobules. So within each lobule of the testis, you have 1 to 3 ducts. Okay, they are called the seminiferous ducts. Seminiferous ductules. Okay, so these seminiferous ductules where there is production of sperms. Okay.
Yes.
So how is the coverings? Next to the tunica vaginalis, you have tunica albuginea, okay, which is a connective tissue layer, which sends septas into the parenchyma of the testis, dividing the
Lobule.
parenchyma of the testis into lobules. Each lobule will have 1 to 3 seminiferous
Ducts.
tubules or the ducts, okay, tubules. So which will form coiled structure, where you have the production of sperms. Clear?
Yes.
So now from these continuation. So from all these seminiferous ductules, all the collection, the sperms, they come and then form a network of, you can say, ducts. Network of ducts, that is called as rete testis. What is it called as?
Rete.
Testis, like reticulum of the ducts, plexus of ducts. Okay. From this rete testis, around again 10 to 12, the ducts arise. Okay. They are called as efferent ductules. What they are called as? Efferent ductules. All these are efferent ductules. So all these efferent ductules, they go and then join one more duct, a single duct that forms again coil. Only one duct which is coiled. Which is coiled. You see here, this is coiled. Only one duct it is. That is the head of the epididymis. So rete testis, seminiferous tubules, rete testis, efferent ductules, then they drain
head
into
of the
epididymis. So epididymis, upper part, it is highly coiled. So that forms the head of the epididymis. And then this, we can say, this is the superior pole of the testis and this is the inferior pole of the testis. Testis are oval structures. Oval structures having a superior pole and then an inferior pole. On the posterior lateral aspect, you have this head of the testis. Okay, and then it comes down towards the inferior pole, forming the tail of the epididymis. And from there, it hooks up again, forming the vas deferens. Same continuation, we call it as vas deferens. Did you see? So this is forming the head, the body, and then tail. And then it again goes up Okay, see here, this is the head of the epididymis. Okay, then it comes here toward the inferior pole and from again runs up. Okay, this is what we call it as the vas deferens. The vas deferens or the ductus deferens, which carries all the sperms which are produced in the testis towards the urethra. Yeah, I will explain that. Wait. Okay, did you get? Okay, see here, this is the testis. There are all these seminiferous ductules, then the retate testis, efferent ductules, then you have the epididymis, the head of the epididymis, then you have the body, and then the tail, and then up, this is the vas deferens.